Have you ever felt controlled by chronic pain? No matter what you did to get rid of it, the sensations just got worse. If so, stay tuned for something called PRT, Pain Reprocessing Therapy, making new brain pathways. Let's do this. Hi, I'm Dr. Lasaria with the Myndfulness channel, a channel focused on brain science and mindfulness-based information and skills to help transform your mind-body so you can transform your life to be the best you. In today's video, we'll cover three things: the new definition of chronic pain, what is pain reprocessing therapy, PRT, and third, we'll get a little practice with something called somatic tracking. That's part of PRT. Before we dive into PRT, let's take a look at a new definition of chronic pain. Here's an updated definition of chronic pain. Chronic pain is a software problem, not a hardware problem. Pain can still exist long after structural or tissues have healed. Did you even know that? Now, studies have shown there's little correlation between your scans and the severity of your chronic pain. Maybe the question that needs asking is, what is your pain trying to protect you from? Research out of Northwestern University in Karin's lab has shown us several things with brain studies. That when pain does not resolve itself within 3 to 6 months, the brain structurally reorganizes itself, the way it processes pain in the brain, into the emotional brain, referred to as the limbic system. Now, his lab discovered something very important, two factors that contribute to the reorganization of the brain into chronic pain. During the time of healing from acute to subacute before it becomes chronic, if people were emotionally distressed, maybe in their life or about the pain, and avoided moving because of the pain, the brain rewired itself into the emotional brain, resulting in chronic pain. Wow, just digest that information for a few seconds. We now know that when pain becomes chronic, the emotional brain circuitries really interferes with the sensory and motor processing networks in the brain, which contributes to the amplification and maintenance of chronic pain. Another wow moment, right? Did you know that trauma and chronic pain share the same brain pathways? Even though the trauma occurred a long time ago, your nervous system, which is your brain and body, really remembers. It's no different than learning to ride a bike. The brain does not have a delete button like our keyboard and the computer does. When we fear pain, the brain gets better at producing pain. Pain reprocessing therapy is a method to help the brain reinterpret pain by one, breaking the pain-fear cycle and thereby reducing or eliminating pain by retraining the brain to reprocess pain signals as being safe. That is, there's no damage here, I am safe. And this is just the brain's way of being overly protective. Now, PRT has 5 components. The first one is to educate you about the brain's role in pain and the reversibility of pain. Pain is a danger signal, and sometimes the brain misfires and creates pain when there's no damage, or also known as a false alarm. The second component is to help you reinforce and gather your own personal evidence of how your pain showed up in the first place, and the reversibility of the pain itself. How? By showing you and asking you to think about when the pain originated, what was going on in your life. Pain originating without any injury, for example. Or you could even have a history of IBS, headaches, migraines, and usual backaches and neck aches, GERD, and also the inconsistencies of your pain, how it presents itself throughout the days and weeks. A third component is gently to lean into the pain, that is, attending to how the pain can be reversed using somatic tracking and reappraising the pain sensations through a lens of safety. A central key skill in PRT is called somatic tracking. Somatic tracking has 3 applications. The first is mindfulness. Now, while mindfulness is helpful, it often does not promote fear reduction. So a second skill is needed called safety reappraisal. And a third application within somatic tracking is called positive associated feelings. That is, lightening up the mood when you're feeling what you're feeling. For example, if your pain is a burning sensation, you can imagine what it feels like to sit in a jacuzzi with that burning sensation, which feels so good. I really like Alan Gordon's humor. He tells his patients to imagine that your body is the ocean and the fishies are the sensations, and he's just a sea turtle swimming by. I gotta tell you, I love that humor. So we'll practice this somatic tracking towards the end. Let's move on to the fourth component of PRT. The fourth component of PRT is addressing other emotional threats: depression, life problems, trauma, unprocessed grief, or not having skills to deal with your inner critics. These issues act as a major barrier to your pain recovery journey. It doesn't matter how many techniques or interventions you receive or have learned. It's really important to address the underlying issue, the issue at hand, your reality, what is going on in your life. Because if you don't, it activates the fear brain circuitries, and then we have double trouble. Often many of my patients want pain recovery, but they're not addressing their underlying issues, their life problems or their life pressures. And here's the issue. You may not be surprised with this, but the pain could be distracting you from facing your reality. So get proper help with the right mental health provider by addressing and acquiring the skills of those other emotional threats beyond your pain. Now, the fifth and last component of PRT is creating positive feelings and sensations. An example of this is to simply use your breath as you watch the difficult sensations that are showing up. In doing so, you create a more positive versus negative or fear of the physical sensations. It's basically a way to help people reinterpret their pain signals as neutral sensations, or as I'd like to say, creating SIMs, safety in me messages, versus DIMs, danger in me messages. It's natural to become very fearful and frustrated when the pain shows up with great intensity. However, science is guiding us that it's not what shows up that matters, it's how we show up and how we relate to the pain. That's the real matter in retraining pain in your brain. Before we get started with somatic tracking, let me just remind you that when you experience pain, whether that be through anxiety or physical sensations, just know it's your brain's alarm that it senses danger. And so when you do this exercise, do it with a sense of curiosity and compassion and of great interest. Because it's a great way to teach your brain that whatever is showing up or that's distressing you, that you're safe. Now, just keep in mind, with that said, the goal of this somatic tracking skill is not to get rid of your pain. The more you try to get rid of it, the more you will activate the danger alarm inside of you. So the goal here is to teach your brain that you're safe, and to some degree that you're going to be indifferent to what shows up. Not to use it as a distraction, but not to be alarmed by the difficult sensations you may be experiencing. And indifferent also may mean just observing without reacting or trying to get rid of it. You're just going to track the sensation, just watching, just observing. So when you're ready, go ahead and take 3 simple breaths in, pausing at the top. And as you breathe out, feel that sinking, melting, letting go, releasing breath. Good. Do that 2 more times at your own pace. And then feeling that sinking, melting, letting go, releasing breath. Now notice somewhere in your body where you feel a sensation of tension or uneasiness, and go ahead and notice that. Notice it with curiosity, a sense of acceptance. Just let it be there as you pay attention to it. Again, with curiosity, a sense of compassion, of interest, without trying to push it away or trying to bring in good feelings. Just watching it. You can imagine that as you're watching the sensations wax and wane, you can notice the size, shape, and quality of it. Just accept what is happening right now without trying to change it. Just notice that even if you have thoughts or emotions that might be showing up as you're observing the sensation in your body, you can just simply label it as thinking, feeling, and come back to watching the sensation in your body. Still connecting with your breath, just remind yourself that these sensations are not threatening. There is no damage in you, that you're safe. You can quietly say to yourself as you continue to observe the sensation in your body by simply saying, "It's okay. It's okay. It's okay. I'm safe. I'm safe. And there's no damage in me. This is just the brain being overly protective. I don't need to do anything right now because it's not harmful, and it too shall pass." Whether it's your back, your neck, your stomach, your chest, your legs, your knees, just remind yourself, I'm okay and all is well within me because I'm healthy and strong. I'm safe. There's no danger here. These are just sensations, inputs from the brain. I'm safe. There's no danger here. Just connecting with your breath, feeling the flow and sensation of your breath as you continue to observe the sensation in your body. And just reminding yourself again that you're safe. And as we come to an end here, connecting with your breath again, pausing at the top, and as you breathe out, gently opening your eyes.